Okay, we're live. Hi, everybody. I want you to meet Dr. Maureen Leonard. She's a pediatric gastroenterologist from Mass General Hospital for Children. And she works with Dr. Fasano. Like, he's one of the rock stars of the celiac world. So tell us what that's like. How often do you see him, Maureen?
Well, I talk to Dr. Fasano most days. We work together on Thursdays all day, seeing pediatric patients and adults with celiac disease and gluten-related disorders. And we also see each other on Tuesdays and Fridays to look at different pathology and have meetings about our ongoing research. So I spend a lot of time with a rock star.
Yeah, right? Well, I know you're really busy, so thank you so much for meeting with us. For those that don't know, Mass General Hospital, I wasn't aware of this until I got better acquainted with your team a couple years ago. They've been around since 1811, and it's the original and largest teaching hospital of Harvard Medical School. So, I mean, I'm so happy. Yeah. Oh, and look, I wore my kale shirt.
Go Harvard.
So I'm so happy that, as I'm sure my audience is, that we have you guys working to study celiac disease and figure this out. So this study that I wanted everyone to know about is this baby study, and I'll let you tell everyone more about it.
Sure. So it's called the CD-GEM study. And that stands for the Celiac Disease Genomic, Environmental, Microbiome, and Metabolomic Study. And we're recruiting infants across the country who are less than 6 months of age and who have a parent or sibling with celiac disease. And what we're going to do is follow them from birth through at least 5 years of age and look at all of the factors, whether they're from the environment, from the genetics that they inherit in their stool or in their blood, to try and figure out why some people go on to develop celiac disease at age 2 and others develop it at age 62. So what's that other factor other than the genes and eating gluten that somebody needs to have to develop celiac disease?
Okay, and so this is interesting. You can either be pregnant now or up to 6 months of age, your baby, you could enroll to be part of the study.
Yeah, so Dr. Fasano likes to say that we would love to take the infants and recruit them while they're still in the oven, as he says. And that's because if we do, then we can also get a little bit of cord blood and a little bit of poop at 7 days after birth from both mom and the baby, which we love. And it's going to waste anyway, so why not give it to us to study?
Yeah, why not? So, and then you're going to follow them for up to 5 years, 1 to 5 years, right?
Yeah, we have funding now for 5 years from the NIH, but the hope will be that we'll continue to follow them and really learn about the natural history of celiac disease. And then going forward, we could help and tell people, you know, the best times to screen for celiac disease. Because that's something that we don't know right now.
Okay, and I'm gonna, of course, put a link to, if you're watching this video on YouTube or my blog, I'm gonna put a link to your website that has more information, of course, all the details of how to enroll. It's just so interesting. You know, you have, your goal is 500 babies, you have 103 so far.
Right.
And you have to live near Boston?
No, so we have 2 centers, Mass General, and then we also have centers in Italy. And we're trying to recruit 250 babies from each country. And what we do is we send all of the questionnaires that are as short as possible through the email. We send everything to collect the stool to your home, so you can collect the stool in your home and overnight it back to us, and we pay for all that. And then we work with you to find someplace close to your home so the blood can be collected there, and then it can be shipped overnight to us. So you don't need to live near Mass General, and even if you do, you don't need to come in to have a study visit. Everything's done sort of virtually.
That is so cool.
Yeah. So we're in 18 states right now, so we'll see if we can get a gem in all 50 states.
Yeah. Isn't that cute? They call them gem babies, like from the acronym. Okay, so now when I read the documents you sent me, a lot of references to terms like microbiota and the microbiome. Now, I'm more familiar with terms like intestinal flora or a bacterial colony. So I'm, assuming from the context that's the same thing, but maybe you could explain that a little more.
Yeah, so in the past couple of years, we've moved away from saying the microflora because we've developed some pretty high-tech techniques to actually look at what bacteria are living on the body or in the gut. So we changed to microbiome, and that really means the collection of all the bacteria that live in the gut, and we identify them genetically now. So we have, instead of growing them in a culture dish, we have really high-tech ways of seeing what bacteria live in the gut, and so the terms have sort of changed to reflect that.
Okay, so it's an update on terms. I love it. Learn something new every day.
Yeah.
Okay, and then so now I've heard too that when a baby is born through the vaginal canal, their microbiome, as we've learned, gathers some of that bacteria from the mother. And that's one drawback to cesarean sections. Now, can you confirm that, or is that related to this in any way, or?
Yeah, so what we're really looking at is what environmental factors alter the microbiome. So we know that there's some transfer of bacteria from the mom to the baby that occurs in utero, but the major sort of bacterial transfer occurs during the birth process. And so if that's a vaginal birth, then the majority of the microbiome comes from mom. If it's a C-section, the microbiome may come from mom's skin or the skin of other healthcare workers. So we're looking not only at how the birthing process sort of helps the microbiome develop, but also what other things affect the development of the microbiome. So whether it's antibiotic use or when foods are introduced or whether certain medications are given, we think all of those things contribute to the development of the microbiome. And researchers have found that the microbiome itself sort of tells our immune system when and how to develop. So we want to learn how the environmental factors are affecting the microbiome and how that in turn is affecting how our immune systems develop.
Okay. I like how sensitive this microphone is. I'll be like, and it'll like focus the camera on me.
Can I do it too?
Anyway, so there was a quote of Dr. Fasano's that, of course, I'm going to butcher it, but if I understood it right, it's saying that this study, if you can identify these biomarkers, that this will play a big role in the prevention of autoimmune diseases in general.
Yeah, so we know these babies and this study is going to change the way we diagnose and treat celiac disease. That's our hope. So our plan is if we can gather this data in infants at risk of celiac disease before they develop celiac disease and after, we can learn what changes in the microbiome and in the immune system that leads to the development of autoimmune disease. And then we can use that as a biomarker. So if we see that certain bacteria increases or decreases before someone develops celiac disease, we hope to use that as a marker of future development of disease. And our ultimate goal will be to make pre and probiotics so that when we see this change in the microbiome, we can intervene before the children go on and develop celiac disease. So this study is let's find those biomarkers, and then our future study will be, now that we have the biomarkers, let's intervene.
And this is like, you made a reference when we were getting acquainted before recording about the banana babies. So this could be as big as that. It's like the next.
Yeah, so the banana babies taught us, that without wheat, that children could survive. And we think that these gem babies are going to teach us why people go on to develop celiac disease and when, and they may teach us how to prevent not only celiac disease, but hopefully other autoimmune diseases as well.
Excellent. I'm so excited. Okay, so tell the benefits. Let's wrap up with what are the benefits of if you have a baby and enrolling your baby in the study?
So the benefits are that they are going to have close monitoring for celiac disease. So we'll test for the TTG, which will test for celiac disease every 6 months. And so they may have early diagnosis and early treatment. They also will have the genetic test run. So at 1 year of age, we do the genetic testing and we give that back to the parents and we'll counsel them on exactly what that means. And then, of course, they're helping to advance science and hopefully change the way we diagnose and treat and what we know about autoimmune disease.
Right. So that's huge, because if you or another first-degree relative have celiac disease and then you have a baby, I can imagine you'd be really concerned about if the baby's thriving and if something's, if the celiac has been triggered, but you can have this top-notch care all along the way and rest at ease. I would do it, but I don't have a baby.
Yeah, I would do it too, so.
Okay, well, again, thank you so much I know you're a really busy lady and doing good work, so really, really appreciate you taking the time to help us to understand this more and to potentially be a part of it.
Thanks so much for having me and helping spread the word about this super important study.
All right, and again, follow the link below if you're interested in participating in the study. All right, thanks again, Dr. Leonard.
Thank you.
Bye.